More minutes.
I think we could start now. That sounds really good.
All right, sounds good. Then I will take it away.
Thank you so much.
Yes, of course. Good morning, everybody. My name is Taylor Cowell. I'm a clinical program manager at Medica. I'm also a registered nurse, which is why I will be giving the presentation about preventive care. And I'd also like to add that on Friday, I have my preventative care appointment. So I am actually practicing what I'm preaching here. So just wanted to throw that in there as a shout out to myself.
Mhm.
So really, kind of what I want to focus on here, why is preventative care so important? Why is it something that is such a buzzword, through Medica, through MHC? Why are we constantly talking about preventative care? Really, it's because preventative care really helps us detect issues early when they're easier and less costly to treat. So that's our biggest focus here. It also helps us to reduce risk of chronic diseases like heart disease, diabetes, and cancer. Again, because we are seeing our primary care provider, we are catching those things earlier so that we can better manage them. And that little blurb at the bottom here, about 6 in 10 Americans have at least one chronic disease that is linked to preventable behaviors, or many of them are linked to preventable behaviors. It also supports long-term health by addressing those lifestyle factors. So again, those preventative behaviors are nutrition, our activity, our stress. Um, Also, it really acts as like a record for our health over time. When you're establishing care with a preventative or with a primary care provider, you're really
Yes,
getting to know
thank you.
somebody so that they are able to they can spot those changes earlier and intervene before those problems progress too. So if you're seeing someone, year over year, it's a lot easier for you to start identifying things earlier versus, just kind of those one-off every couple of years. It also establishes a clear pathway to guide you when you need care. So a lot of times those specialized care really starts with our primary care. They're the ones who are able to lead you, give you those referrals to specialists, find those providers that would really work well with you. And again, it empowers individuals to take an active role in their health so that you are really feeling like you are working with our providers, really making your own personalized care plan. Just some data about MHC. About 20 to 25% of the population has received some type of preventative care within the last year. So again, a really big opportunity here to encourage our members to use their benefits. So what can you expect during a preventative care visit? So again, we're really focusing on staying healthy, not treating illness in these preventative care visits. What'll happen usually first is that review of personal and family medical history. A lot of times this is done before. So a lot of times they will send you kind of a questionnaire to fill out so that you aren't wasting time, kind of doing that on the fly. So a lot of times you'll get those before and you can really give a lot of detailed information for your provider to go over before your appointment so that they're ready. Also just doing that routine physical exam, vital signs, looking at your blood pressure, things like that. And then they focus on those age and risk-based screenings. A lot of those are because looking at your family history and your personal history, those can also lead those screenings. Are you more at risk for cancer? Are you more at risk for higher blood pressure? So that also directs our conversation, kind of what needs to be focused on in that meeting. Discussion of lifestyle habits. So another place to really discuss our diet, our exercise, our sleep, our stress. Another place where you'll get most of your vaccinations will be in your preventative care visits. So really going over that, making sure that you're up to date with your vaccines, that everything is aligned. And then an opportunity to ask questions and set health goals. So again, this is really focused on you as the individual and kind of, what you're looking for with your preventative care. Just kind of a side note on the benefit itself, preventative care visits are no cost when focused on routine prevention. So kind of what that means if during the preventative care visit, you then start discussing, existing conditions. Say if you have diabetes, you start going over, your medications, things like that, or an illness that you currently have that may be billed separately and subject to cost sharing, similar to a standard office visit. So just something to note if you're not really focusing just on preventive care, that there may be separate charges related to that. So when do you need a preventive care visit? This is really broken down into different age groups here. So if we're looking at infants and toddlers, they are going to have the most well-child visits. So those preventive care visits throughout the year. I know this because I have a 5-month-old little guy, so I know that he's gone to many well-child visits already in his life. So that's when we see the most in that infant and toddler stage. If we're looking at children, teens, adults, and seniors, usually it's about once per calendar year that we're seeing those preventive care visits. But You may have multiple preventative care visits throughout the year. So say, as a woman, you need a mammogram and then also a preventative OBGYN exam. Those both would be covered because both of those are preventative care services. They just need to be done at different times. So that's just another thing to think about. It's not just that one visit. There may be multiple reasons why you're going in for different types of preventive care. So then how do you schedule a preventative care visit? If you don't already have a primary care provider, a lot of times you start with looking for that in-network provider. I know for me, I'm in an ACO here in Minneapolis. I'm in our health partners in Park Nicollet ACO. So for me, it's a little bit easier because I already know kind of what clinics are within my benefit. But again, if you're in a passport, you may have a lot more options. So again, it's really starting to look for those in-network providers. So you can call the member services number on the back of your insurance card. You can also visit medica.com or use that Medica mobile app and really search for providers that will be covered under your benefit. So it's a little bit easier. And then contacting that primary care provider directly. A lot of clinics allow you to schedule appointments online through their patient portal. So if they use my chart or on their website, I know again, just example of myself using Health Partners, I was able to establish even as a new patient, I was able to just online schedule an appointment directly with a clinician. So that was really, really helpful and really made it easier for me to schedule that appointment. And then again, just calling the clinic directly to schedule. A lot of times it is easier just to speak to a human. They're really able to direct you, kind of find providers that might fit with what exactly you're looking for. So there's many different options to schedule those appointments. And then kind of just my last slide here, how is behavioral health addressed in preventative care? We talk a lot about mental health and how that's really important. So what they kind of do in our preventative care visit is really checking in on stress, mood, sleep, and mental well-being. Also, most primary care clinicians can also manage those behavioral health meds. So a lot of times you don't then have to go to a psychiatrist to have them manage. Most of kind of, basic medications can be managed by your primary care provider. So that kind of cuts out another provider that you need to see, which is really, really nice. You only kind of have to go through one provider. This is also where a lot of screenings are done, for anxiety, depression, substance use when appropriate. And because of these screenings, and they're able to direct you to different resources. They have so many um, other clinicians that they work with that they can refer you to. So again, it's really nice to have that primary care provider so you can kind of start there and then they can refer you out to different providers as necessary. And that's it for me from preventative care. I think we have some time for questions if there are any. Otherwise, I can hand it over to our next speaker.
Taylor, it does look like there are a few questions in the chat.
Yep.
Let's
I know. I think
see.
it moved it so I couldn't see it during my presentation.
Are basic clinical chems covered like lipids, blood pressure, A1C considered preventive care?
Yeah. So again, those should fall in with preventative care when you're looking at those things. So again, like those screenings that they're doing, like with your cholesterol, things like those different panels should be covered under the benefit.
Okay. And then during an annual preventive care visit, if weight is discussed or weight control or options regarding the topic are brought up, would that be an extra charge?
That one I might have to get back to you on just to make sure that it would just be covered in there because sometimes that can then lead to other discussions as well. If you're then looking at like medications, things like that. So let me write that down and then just get back to you just to make sure that we give the correct information.
Sounds great. Someone else asked about preventive care, why doesn't it cover a blood test example, a lipid panel every so often? Which I feel that it does, but maybe it's because the person has been diagnosed already
Yeah,
with a high cholesterol, then it's no longer considered preventive, if I'm not mistaken.
correct. Yep. So a lot of times this is again, doing those screenings and trying to catch things when it's then now we're managing a high cholesterol, then that's going to fall into those kind of standard office visits instead of just that preventive care benefit, unfortunately.
Mm. Excellent. I think unless someone else has anything, I think that's
There was
about
one
it.
more about,
Oh, yep.
you see that one?
Um, yeah, so a doctor's visit for a check-in for birth control medication, is that considered preventive or that be addressing a specific topic?
I think, again, let me get back to you on the actual specifics with that one, because I know sometimes with women's health, it can be a little bit different too of kind of what you're discussing in that. So I will write that one down too, just as another check to make sure if that's going to get covered in that preventative care.
And then does the visit need to be at least a year apart from the last visit or just annually?
Annually. I double checked that one. So not exactly a year, just within that like calendar year. So again, they can be closer than that 12-month period.
Do you still have to pay your deductible for a preventive care?
For that one, preventive care should just be covered fully without the deductible. But again, I will double check just to make sure that, because I know that's how my benefit works too. But again, I will double check everything.
Taylor, I can save that one for you. So on all of the plans for MHC, if it's billed as preventive care, it is paid at 100%.
Perfect. Thank you.
Excellent. So I think let's go ahead and move on just so that we can stay on track and get through everything since we have about 20 minutes left, if that's all right.
Okay, I can go ahead and jump in. We're going to discuss, I'm sorry, I'm multitasking, trying to figure out how to share and talk at the same time. Did my screen come up?
It is up, Brent.
All right. So, um, there we go. We're going to talk about virtual care. So, virtual care, it's kind of a, well, let me first start by saying thanks for the opportunity to speak to you today. And I am really challenged by all the words, the goals that people had for 2026. I kind of feel like I need to be a little more ambitious myself now. And it's always a privilege. You know, we get out fairly often, and usually when we're talking to members, we're talking about deductibles and co-pays and things like that. So it's fun to have opportunities to talk about benefits that don't fall into just deductibles and co-pays. And virtual care is a fantastic benefit for our members. If I can say I think they're boy is it amazing. It's almost 6 years ago now that everything shut down with the pandemic, and not a lot of great things happened as a result of the pandemic. But I think we have a couple examples right here, right now. One of them is that we've gotten used to getting large groups of people together, and we can do it on our screen instead of having to worry about the logistics of getting everybody together in a room. So I think that's been one of the silver linings, one of the benefits. And another one is virtual care. So prior to the pandemic, we had very few virtual care options. I don't know if I would have even been able to tell Medica members what your virtual care options were with any certainty before the pandemic, but we do have several options now. We'll talk about those. And virtual care can be provided much more efficiently. There is more awareness of virtual care and when it can be used, and we'll talk about that too in the next couple minutes here. But our goal today is just to make sure that you're aware of what your options are for virtual care. We'll talk about benefits of virtual care too. So starting with Medica Call Link, probably a lot of you are familiar with Medica Call Link, our nurse line, and maybe you wouldn't consider it virtual care, but Call Link, Call Link is a resource for you where you can get advice on treating a condition at home or advice on whether maybe this is something that you should go to the doctor's office for, maybe to the emergency room. So using Call Link is kind of a triage, really a valuable resource. And so with Call Link, our hope is that members are using it, number one, to make sure that they're getting appropriate care in the appropriate setting. We don't want to tell people where to go to receive their care, but we want to make sure you're aware of the resources that will help you make an informed or an educated decision on where you go to receive care. So I know we don't have a lot of time, but I like to let people know. I was at an employee meeting many years ago now, and I think this is one of the best examples I was ever given on how Medica Call Link can really help you out. It was a family. They were out of town. They had a young daughter, 2 or 3 years old, if I remember correctly, and she was stung by an insect. And so their first thought is, oh my goodness, we're probably all aware some bee stings or insect stings can result in really adverse symptoms, or it can be a big issue. And so their initial thought was, we want to get her to an emergency room and make sure she's going to be okay. But they didn't know where to find an emergency room where they were. So they called Call Link. Call Link can tell you where the nearest emergency room is. But after walking through a series of questions from the nurse that they spoke with that day, the nurse was able to assure them that if their daughter was likely to have any type of adverse side effect, her symptoms would have been a lot different at that point. And so they were given some advice on keeping her comfortable, things to watch for. They ended up not going to the doctor at all. And they were thrilled because, number one, their daughter was okay. It wasn't a serious condition. And probably a lot of you are aware, an emergency room visit is typically going to cost several $100s. So they did not have to pay for an unnecessary emergency room. So again, whenever we're going through this slide or talking about Medica Call Link, when I use that example, I always make sure I let people know there are absolutely situations where an emergency room visit is necessary. So we're not discouraging people from going to the emergency room, but we want to make sure that you avoid an unnecessary emergency room visit that costs you a lot of money. We don't want you paying for things that you don't need. And the opposite could be true too. I won't tell the whole story, but I know personally, when my kids were younger, I've had at least one situation where we had thought it was something we could manage at home. And after speaking with the nurse on the Call Link line, we ended up taking him into the emergency room, and it was the right choice. So remember, Medica Call Link, maybe not something you think of as virtual care, but it really is a great virtual care option. What are your options for where can you go for virtual care? So, we just talked about Medica Call Link. That's maybe we could call it a non-traditional virtual care option, but you do have a lot of other what you would maybe think of as virtual care options available to you. So there are clinic-based options. If you're on Medica Passport, you're probably going to have a lot of those available to you. If you're on one of our narrower networks, you're on an ACO or on Medica Elect, you're still more than likely going to have access to care from a larger care system. And most of those larger care systems will have virtual care. So that's something you can research, ask your doctor about. Maybe when you're getting that preventive care, you can ask if there are virtual care options through the clinic that you're using on a regular basis. The prices for clinic-based virtual care, that's going to vary depending on where you go. It's almost always going to be less expensive than if you go into the doctor's office and see someone face to face. Amwell is the largest virtual care option in our network, and Amwell is available to everyone, regardless of which network you're using. So if you're using Open Access Passport, of course, you have access to Amwell, and Amwell is also available to anyone on a narrower network. So any of the ACOs or Medica Elect, you're still going to have access to Amwell providers. And Amwell provides a very broad range of virtual care. In a slide or two, we'll look at examples of care that can be provided virtually. Another nice thing about Amwell is the cost is fixed, so you know what the cost of your virtual care visit is going to run before You get started on that virtual care visit. I've had people ask, well, what if I think I have something that can be treated virtually? I call Amwell or any of the virtual care providers, and they tell me it's not something that can be treated virtually. Do I get charged for that visit? And the answer is no. So if you think that you have a condition that could be treated virtually and that would be a good option for you, don't be afraid to contact a virtual care provider. You're not going to get charged for a visit when care isn't provided. Amwell also provides behavioral health virtually. With behavioral health, the cost is not set. So depending on the care that's provided virtually, the cost may vary a little bit. But again, you can be pretty confident that any care you receive for behavioral health conditions, it's going to cost less than if you went into a provider's office. And the website for Amwell, pretty simple. You can see that there. Virtuel is another great option for virtual care. They're based in the Twin Cities, so familiar. I know that means something to a lot of us. Virtual care is not available in all the networks that Medica offers. So it is an option for members who are on the Medica Passport plan. You can use Virtuel if you are on Elect and in the Park Nicollet care system. You can use Virtuel, and then the same would be true if you are using the Park Nicollet Health Partners ACO. You can use Virtuel. So Virtuel, very similar to Amwell, they provide most of the same care that Amwell provides. They do not provide behavioral health care, but virtual treatment of a lot of medical conditions is available through Virtuel. So great options available to you or you have a lot of options as far as providers that can provide virtual care. Virtual care, what are some of the conditions that could be treated virtually? So we don't need to read through the whole list there, but a pretty wide range of diagnosis and treatment is available virtually. If you have young kids, it seems like a lot of the things that kids run into are things that can be treated virtually. So over in the right-hand column, the pink eye, rashes, strep throat, there are things like that where I think my kids, well, I was just going to say, I think my kids are pretty normal. Maybe in most cases, they're pretty normal, but they would have pink eye, maybe once a year. And so we know what pink eye looks like. We don't need to go into the doctor's office. If we would contact a virtual care provider, they could prescribe the medication that's needed to treat pink eye. And we don't need to make that visit to the doctor's office to get it. Same thing might be true for, strep throat, the rashes and things. And even if it's something that they haven't had in the past or you're not sure what it is, virtual care is a great place to start. And like I said, if it's not something they can treat virtually, the provider won't charge you for that visit. What are some of the benefits of using a virtual care provider? So, you avoid that trip to the doctor's office. And I know on the previous slide, like flu was one of the things that was mentioned. And that's been, we've had kind of a tough flu season here in Minnesota. And if you have the flu or just about any illness, if you're not feeling well, you don't want to leave the house. It's kind of nice if you can stay home in your sweats or stay home in bed and not have to worry about going out to the doctor's office. So, again, if it's a condition that is able to be diagnosed by a virtual care provider, they can also get that prescription to a pharmacy that's convenient for you. And so you're avoiding that visit. It's convenient, so you don't need to make an appointment. You just get on the website or call the virtual care provider. Very simple. It's where they come to you through your phone or your computer. So that, of course, is a great benefit. And then for a lot of us, some of you, said you wanted to save money in 2026, this is a great way to do it. Virtual care visit a lot of times is half, a lot of times less than half what it would cost if you received that same care in a doctor's office. So those of you that wanted to save money this year, remember, if you have a minor condition like some of those that were listed on the previous slide, give virtual care a try. Great way to save some money. Some of the other resources that you have available, so these would be things that are, well, before we get into that, just a reminder, if you're not sure where to, maybe it's 3 or 4 months from now, and one of your kids has pink eye, and you remember, boy, I know we have virtual care options. Where do I find those providers? If I can just do a quick plug for Medica.com. We have Medica.com, the regular website that anybody can get to. But if you have never set up a member account through Medica.com, it's a great resource for you. One of the things you can do is locate providers that are in your network if you have your own Medica.com member site set up. So go to Medica.com. Of course, you can call customer service as well. They would be able to help you find virtual care providers or let you know what your options are. But Medica.com, a great option. And then you'll be able to find providers of just about any type, but virtual care has its own category. So if you click on that, it will bring up virtual care providers that are in your network, and it will list their contact information, website, phone number. So you very easily can find that information. Just a couple other resources you have available to you specific to behavioral health. So as we mentioned, Amwell has behavioral health available. If you use an Amwell provider, you would access Amwell the same way you would for a medical condition if you're seeking behavioral health care. And then Talkspace is a website where a great onboarding or kind of a great place to go if you want to dip your toe in the water and see if behavioral health would be a good option for you. So some of the same things that we talked about when we were talking about recommendations that your primary care provider could make related to behavioral health, Talkspace is a great place to go for that. Live and Work Well is a behavioral health website specifically dedicated to behavioral health. So we don't have time to talk about it today, but we have other websites or apps dealing with physical or medical conditions. Live and Work Well is specific to behavioral health. So if you, again, think I may benefit from behavioral health care, or maybe just are looking for things you can do. Again, at the beginning when people were talking about self-care, taking care of ourselves, Live and Work Well will give you a lot of great information related to what you're feeling. Maybe it's stress, or I think I may have depression. Live and Work Well can help you walk through where you are at and whether care from a behavioral health provider may be helpful for you. So that's a quick run through virtual care options for you. I'm sure for some of you, you are familiar with most of these already, but I hope, like I said, we're trying to increase awareness to help people know about all the resources that you have available to you as a Medica member and help you make more informed choices as far as where you're going to receive your care.
Excellent. Thank you, Brent. Just a couple real high-level questions that are in the chat that we can cover real quickly. Does virtual care count towards your deductible?
So if you have a plan where your virtual care visit, if it goes toward your if you have a deductible, it would go towards it. Yes. So it's going to be covered under the office visit benefit. So there are some plans where you just have an office visit copay. But if you have, for example, a high deductible health plan connected to an HSA, everything goes toward your deductible. And that would be true for the virtual care visit. So yes, if you have a plan where your office visits, you just have a copay, it doesn't go toward your deductible. Your virtual care copay is going to be less than what your copay would be for the office visit. And then, for a lot of us, if we have plans where office visits do apply to the deductible, that would be true for a virtual care visit too. Yes.
Excellent. So just a couple more that we'll get through, and then we'll reach out to people with answering as many questions as we can later. But does annual or virtual connect to my chart?
That's a good question. Can I take that away and get
Yep,
back to you?
perfect. What about, can you be assigned a PCP if you're using these virtual options so you're seeing the same person each time?
Let me confirm that also. I believe that you can if you're being treated for a condition that comes up once in a while, but I should be clear too. We wouldn't recommend that you replace your primary care provider with a virtual care provider. They're more intended to treat things that come up sporadically. But I'll confirm that and we'll get an answer to that question.
Okay, and then just one more. Um, do you, like, if you're calling into a virtual care or the Medica care link or call link, whatever that was called, sorry, do you have to be the individual talking about the specific condition? Can I call in and ask a question about my granddaughter if she's not on my plan, or does it have to be for myself only?
So technically, it's supposed to be for Medica members. I will tell you, if you have a granddaughter that's staying with you and maybe has a high fever, you as a Medica member, if you contacted Call Link, they would give you the same information as if your granddaughter was the Medica member.
Excellent, thank you. Okay, so I think that's all we have time for right now. But I have jotted down all of these questions that are within the chat. So we will come up with a way to formulate responses and get them back to you. The presentation will make available, so I'll get that over to MHC so that they have it. But otherwise, thanks everyone for attending and a lot of great questions.
Thank you so much, everyone.
Thanks, everybody.